Bismillahirrahmanirrahim. Thank you for giving me an opportunity to present in the second International Brain and Biomedicine Conference. My name is Dr. Tayyaba Shaheen, and I'm Associate Professor in Department of Bioinformatics and Biotechnology, Government College, University, Faisalabad. And topic of my presentation is natural polymer-based hydrogel from Plantago veta seed husk for the treatment of diabetic wounds. First of all is the introduction. Chronic wounds are considered as a silent epidemic, and according to reports, about 8.2 million people suffered from acute or chronic wounds. Diabetes mellitus is related with poor wound healing, and diabetic patients are more prone to developing chronic wounds because of chronic hypoxia. Sustained oxygenation cannot be achieved by hyperbaric oxygen therapy. Diabetes mellitus, which is commonly known as diabetes, is a metabolic disease that causes high blood sugar. With diabetes, your body either doesn't make enough insulin or can't effectively use the insulin it is producing. Diabetic foot ulcers are the most common complication of diabetes, and 25% of the diabetic patients, they experience diabetic foot ulcers, and it causes prolonged pain, decreased vitality, and possibly the need for foot amputation. Here are the stages of the formation of diabetic foot ulcer. At stage 0, there is no open lesion. At stage 1, a superficial ulcer is seen. At stage 2, deep ulcer. At stage 3, osteitis. At stage 4, partial gangrene of the foot. And at stage 5, gangrene of the whole foot occurs. How hypoxia affects wound healing? Hypoxia is the condition in which oxygen concentration is very low in the body. In non-diabetic people, there is a balance between the hypoxia and the transcription factor HIF1, which responds to the hypoxia, and proper adaptive responses to hypoxia are taken, and body remains in the homeostasis condition. While in diabetic patients, the balance between the hypoxia and HIF1 factor is disturbed, which results in the impaired responses to hypoxia, which results in diabetes and diabetic complications, which includes diabetic foot ulcers. Usually, hyperbaric oxygen therapy is used to treat hypoxia. HBOT delivers 100% oxygen at 2 to 3 atm for 1 to 2 hours per treatment to patients with DFU. And this therapy is a systemic oxygen delivery strategy, and it may create risks of tissue hyperoxia, such as oxygen toxicity seizures. And this therapy needs a lot of treatments, like 4 or more treatments for promoting diabetic wound healing. Now, hydrogels are hydrophilic, 3-dimensional networks that are able to absorb large quantities of water or biological fluids. And hydrogels are widely used as debribing agents, moist dressings, and components of paste and wound care. Polymers which are used for hydrogel formation, usually hydrogels can be prepared from either synthetic polymers or natural polymers. But bio-based polymers are attracting more attention for use in biomaterials due to the recent demands for a reduction in the environmental impact of the polymer industry and the development of a sustainable society. Plantago veta. This is a plant, and its common name is ispahol. It belongs to the Plantaginaceae family, and it contains mucilaginous polysaccharides, and it contains natural rabinoxylans, arabinose 22.6% and xylose 74.6%, and it has a lot of benefits for diabetic patients. Objectives of the study were to exploring potential of natural polymer-based hydrogel in the treatment of chronic diabetic wounds, and exploring efficacy of natural polymer-based hydrogels under controlled conditions and on mouse model trials. Here is the work plan. First of all, polysaccharide extraction, then hydrogel synthesis, then in vitro and in vivo experiments, and then the compilation of results. First of all, polysaccharide extraction. Psyllium husk was used for the polysaccharide mucilage extraction. It was mixed with normal water and then placed on hot stirring magnetic plate and then press filtered to get the extracts. Hydrogel was formed by grafting, then washing and drying, then saponification, and again washing and drying was performed, and then hydrogel was formed. In vitro experiments, alpha-glucosidase inhibition assay was performed, in which 96 Wells plates was used for antidiabetic assay. Psyllium mucilage extracts were tested to inhibit levels of alpha-glucosidase. Glucobay was used as a positive control. And in antioxidant activity, DPPH assay was performed to calculate the radical scavenging ability of psyllium mucilage, and gallic acid was used as a standard. For in vivo experiments, 8 weeks old mice were taken, and their blood glucose levels were made high using streptozotocin. And following all biosafety rules, wounds on the dorsal skin were created, and hydrogel was applied on the wounds. Now comes the results. Antidiabetic activity assay, percentage inhibition of plantago beta mucilage against diabetes mellitus was calculated, and at the concentration of 125 milligram per milliliter, the mucilage performed better as compared to control. While in antioxidant activity of plantago beta mucilage, the mucilage could not perform better than the control at any concentration. And in vivo experiments, when we examined the hydrogel treated group, the wound from the day 3 to day 18. At day 18, the wounds were completely covered and mice were recovered. While on non-hydrogel treated group, from day 2 to day 18, wounds were observed, and at day 18, wounds were still slightly open and they were not completely covered. So a comparison of rate of healing between control and hydrogel treated group was performed. And in this graph, you can clearly see that non-treated and treated groups, they have a difference. In non-treated group, the recovery was slow as compared to treated group. So in conclusion, the goal of this research was to assess the antidiabetic effectiveness of psyllium-based hydrogel in treatment of diabetic ulcers through enzymatic assays and mice model experiment. The potential results were identified and studied. Thank you for listening.